I'm going to do a simple continuous line to close the skin layer on this model. Most surgeons will place a simple continuous line, or almost any continuous pattern, from their dominant to their non-dominant hand. Because I'm a right-handed surgeon, that means from right to left. So I'm going to come down about 5 millimeters from the end of my incision and pass my suture down about 5 millimeters back from the edge and up 5 millimeters back from the edge. If there's a distance between the skin edges and I need to come up in the center, I can do that in order not to have to pull on the tissue too hard. I'm going to gather up my suture and tie my initial knot. Nylon will remain loose on the first throw, a little tighter on the second, and comes to full tension on the third throw. I only want it tight enough to bring the skin edges to apposition, but not enough to make them crinkle up or to create problems. Because this is a non-absorbable suture, nylon, I'm going to have to go back and take these out later. So I'm going to leave longer tails, 1 to 2 centimeters, so that I can get them out easier when my patient comes back. So after I've tied this initial one, then I'm just going to continue on in much the same manner, 5 millimeters back from each cut edge, and roughly speaking about 5 millimeters apart. As I do that, I'm going to end up with diagonal lines, or what appear to be diagonal lines, across my incision. The diagonal line is normal because you've taken a bite that goes straight across and you're hooking on and seeing the way it lays diagonally before the next bite. When it comes time to finish your pattern, so leave those 2 stitches, and we'll say I'm ready to finish my pattern. I'm going to place one final stitch and tie to the loop that's created by making the stitch. In other words, to keep this loop and to tie to it. This pattern is frequently used when we need something that's a little quicker than a simple interrupted. But keep in mind that the entire security of this pattern rests on the 2 knots at either end, and 1 knot failure or 1 suture breakage will cost the entire line. For that reason, just to be safe, I'm going to put 6 throws on this knot with a loop. When you tie to a loop, the knot is asymmetric, and so it's naturally a little bit weaker. And then I'm also going to cut these again at 1 to 2 centimeters of length.